Let's say this was the foot that was hurting. So the very first thing I think about is usually I want to think about the talocrural joint. That is the joint right here, which encompasses the ankle bone. And that's where basically your tibia and your fibula meet this dome right here, which is called the talus. By the end of this routine, what you should notice is you should notice less foot pain overall, less ankle pain, less stiffness, and you might even notice some improved blood flow and just the way how your foot feels. So again, I really hope this helps you. Watch the end of this video and let's go ahead and get started. Hey guys. Dr. J here. I'm very excited to just share a really quick foot mobility routine that can help resolve a lot of foot symptoms, whether you have plantar fasciitis or whether you have some sort of Achilles or ankle stiffness. I'm going to share with you in just 3 to 5 minutes how you can get rid of that very quickly, and you can do this step by step. And please watch to the end of this video, because the reality is that when you put in the work and you're able to follow it step by step exactly how I do it, you can therefore kind of recheck how your foot and ankle feels. And I really hope that it really helps you, because I've shown this exact routine to so many of my clients and I'm revealing it to you guys right now. So if you do like the video and you find it valuable, make sure to comment below, click that like button and subscribe. We do host weekly videos Mondays at 5 p.m. All right, so let's kind of get into that right now. So let's say my ankle, so this one right here, let's say this was the foot that was hurting. So the very first thing I think about is usually I want to think about the talocrural joint. That is the joint right here, which encompasses the ankle bone. And that's where basically your tibia and your fibula meet this dome right here, which is called the talus. So what you want to do here is you want to start first of all at the talocrural joint, because that can solve a lot of issues right away. The next thing that I work down towards is called the rear foot. Okay, so the rear foot, I'm gonna work on some mobilizations there. Then I'm gonna work at the midfoot. The midfoot is often an area that's oftentimes very stiff. It can oftentimes, if the midfoot is stiff in any way possible, that can actually limit how much the talocrural joint can actually move. And that can limit things like squatting, going upstairs. If you ever felt like you were squatting down and then your ankles were feeling restricted or stiff, you might want to look at the midfoot. So I'm going to show you exactly what to do from there. And then we're also going to look at the forefoot as well. So look at the toes, exactly how to mobilize the foot. So usually by the end of this routine, what you should notice is you should notice less foot pain overall, less ankle pain, less stiffness, and you might even notice some improved blood flow and just the way how your foot feels. So again, I really hope this helps you. Watch the end of this video and let's go ahead and get started. So I want to give you a close-up view of my foot. So usually you'll have yourself barefoot. The very first thing is we're going to look at the talocrural joint. So I'm going to basically pin my ankle down onto my thigh. I'm going to put my thumb on the bottom of the foot and then 4 fingers at the top. So what you're going to do is you're going to grab it. I call these ankle cranks. We're going to crank our ankle down. And usually you want to get it until you can't go any further. So I feel like kind of a big stretch at the top of my foot. We're trying to unlock that talocrural joint. And I kind of think of it like kind of cranking a well, like you're kind of cranking water out of a pipe. So I'm going to move this, and usually I do this about 15 to 30 times, either for just relief, or I'll also even do this before I do any sort of weight training or any sort of sports. So if you have any like chronic stiffness in the Achilles, the foot, the ankle, and you feel stiffness in your ankles with running and all those more intense activities, this can be a great one for you to do. So again, we're going to work at the talocrural joint first. And then usually if you can, what you can do is also you can crank down and add a little bit of a J scoop. So crank, J scoop, and that can oftentimes kind of unlock the lateral side, especially if you have more lateral sided pain, okay? So quickly, now what we're going to do here is now we're going to work at the rear foot. So the rear foot encompasses the heel. Usually a couple things I do is I'm going to get my thumb and I'm going to push down directly into my ankle. Now, if you have any discomfort, just kind of push gently enough that you feel a little bit of a stretch. But some people can feel either discomfort either directly in the heel or on the outside. So you want to kind of just gently push down, almost like you're kind of giving CPR. So like CPR, that kind of rate. And I'm just kind of pushing down and mobilizing the rear foot, okay? Now, after I get about 15 to 20 of those, now we're going to work at the midfoot. So now I'm going to shift this hand, so my left hand on my right ankle, I'm now going to move towards the midfoot. So I'm going to get in first a little bit of midfoot mobilization. So I'm going to actually get my pinky toe, grab the 4 fingers, and now I'm going to kind of force my big toe down and I'm gonna crank my midfoot into what we call eversion, okay? So I just wanna kind of crank it, get it to the point where I can't move anymore. And we're gonna do that about 15 to 20 times, okay? And then the next thing I'm gonna do here is I'm going to switch my grip so that I'm, again, stabilizing that midfoot, sorry, the rear foot, and now I'm gonna crank into midfoot inversion, okay? So inversion, okay? And you notice that with the thumb, I'm limiting the motion from the heel, so that way the rear foot's not moving at all, and I'm isolating the midfoot to go into inversion, okay? Again, 15 to 20 times here. Okay, and the hand placement for the midfoot can be in many places. So like if you wanted to go here, you want to switch your grip, you want to kind of crank a little bit more into midfoot, switch the hands, you want to go into that position. But basically, these are really important to get midfoot eversion, which is the pinky toe goes up, the big toe goes down, and you also want to crank into inversion to fully mobilize that foot. Now, the last thing we're going to do here is a couple exercises. One, we're going to stabilize the rear foot, and then we want to get a little bit of a plantar fascia stretch. So look how I kind of crank the toes or the forefoots. I crank the toes into extension, and you can kind of feel that, look, that little bit of stretch on the plantar fascia. Crank into some toe extension, and I'm stabilizing the heel, right? So, because if I don't stabilize the heel, look what happens. Then I get all that motion from the talocrural joint. So I want to stabilize that rear foot and then stretch out that midfoot, okay? Then the other thing we do is almost like what I say is like when you kind of crack your knuckles with your hand, as you can see, like kind of crack the knuckles. You want to now stabilize that midfoot. So look, I'm grabbing the midfoot, and now I'm gonna crank the toes down. Usually you can kind of get a little bit of crack or decompression in your toes, which is great. Okay, so you kind of crank, especially the big toe. Really important that we kind of get into that big toe. So I can grab the big toe, and I'll grab all 5 toes and crank that whole forefoot, okay, into toe flexion. All right, now this is one of the magic exercises here. I think this is one of the greatest ones that you can do because it really gets just a lot of blood flow, and it also makes your midfoot, get your balance better. You wanna get your fingers in between each toe. I know, wash your hands after. We wanna get your fingers into each toe. Okay, look at that here. So now we're kind of spreading the foot. I'm gonna stabilize the midfoot, and now I'm going to do some circumduction, okay? So I call this toe spread with circumduction. So we're going into clockwise circles with our fingers in between our toes. A lot of times you can hear a lot of like crepitus and a lot of things moving. So we're getting just all those little individual joints within the foot to move, okay? Because when we put our feet oftentimes into those closed-toed shoes, we get ourselves into those shoes that oftentimes compress our foot together. That's why I always opt for like Vivo barefoot or more minimalist shoes or wider toe box shoes, because if you continue to put yourself into shoes that are really narrow, then it narrows out the foot. It disturbs the integrity of your foot. It brings your toes together. You're less balanced. And a lot of people will start to have a lot of foot pain when they're wearing these shoes that are too supportive, or oftentimes narrows out your foot. So it's always good to kind of reset your foot with these. You go into the opposite direction as well. Okay. And then usually what you can do here is you can kind of just like wiggle your toes, you can walk around, and you can oftentimes really feel a difference in terms of how this foot feels versus the other side. Then once you're done, then obviously switch the other side, do the same exact routine. So for all these different exercises I just showed you, usually about 15 to 30 repetitions per exercise. And again, I really hope that this helps you. If it does, hit that subscribe button, like, comment, also let people know that's effective, because the more you comment, the more people that will engage with the video, and this foot mobility routine can therefore be shared with many people across the world. So I really appreciate that. So like I said, this was an exact routine that I actually do for myself. If I played any lengthy bouts of basketball or I went for a long run, oftentimes ankles and joints and different tissues in the foot really need that reset button. And I really hope that this routine will help to facilitate faster recovery, reduce any sort of foot ankle pain. So if you haven't yet, make sure to click that subscribe button, also comment below. And if you're interested in learning how to get rid of pain If you're interested in learning how to get stronger and more resilient as you get older, make sure to scan this QR code right here. If you do, you'll be taken to an application page where you can apply directly for one-to-one coaching with our team. And we look forward to seeing you on the inside. So take care and have a beautiful rest of your day.